Okay, ready to get started, Brian?
Yes, I am.
Okay, perfect. Hello, everyone, and thank you for joining us today. Welcome to the Delta Region Community Health Systems Development Program Communications Toolkit and Phase 2 Vaccine Confidence Initiative. This is our funding statement. With the support of the Delta Regional Authority and the Health Resources Services Administration's Federal Office of Rural Health Policy, the Center administers the Delta Region Community Health Systems Development Program. Okay, this is our speaker for today. Brian comes to Legato with decades of healthcare communications expertise, most recently as the Vice President of Brand Strategy for Prevea Health and HSHS Eastern Wisconsin Division. Brian has been an active participant in the AMGA Leadership Council. Over the years, Brian has combined his creative skills with business leadership as a creative director and agency owner. He holds a BFA degree from the University of Wisconsin, Eau Claire. This is our agenda for today. We will have a reintroduction of the 2021 Customizable Communication Toolkit. Then we will have a COVID-19 Where Rural America Is Today. We will preview of the updated COVID-19 Vaccine Confidence Toolkit and also customization support.
Well, good morning. I am seeing some familiar faces and names from past webinars that I've been involved with, so it's great to see you all again. As said, Legato Healthcare Marketing, as I should say, as Ambrisha said, that we are a partner with the Resource Center. We have been involved with providing education for many of you over the past 2 years through our webinar series. So that, it's something that we're hoping that piece will continue into the future, that we can continue to provide education on communications and strategy and new medias too. So for each of you, so that to be introduced to that through the experience that we have with rural health across America. But as the other part of it is, we have been involved with the communication toolkits. I do understand that there are some new members that are part of the Delta group that have not seen this, and we were asked to, first off, just kind of do a quick recap of what is within the communication toolkits. The other piece that we have done, as noted, is we've done some updates to the toolkit, which I'll touch on a little bit further into the presentation. We did get some, prior to doing the updates, we had discussions with many of you about some of the challenges you were facing. When we look at the communication expansion of what this piece is, some of that was included, but there is also, if you recall, we are also working with NRHA with their communication strategies for rural, the support pieces of their toolkit too. Right now, just for those people that were involved with the focus group, we did listen to you, and some of that we are taking forth within NRHA also. So that being, we're working with some what we consider beta hospitals to test messaging into the future. So I think as time goes by, these are things that we will pass along to Ambrisha, to other individuals at the Resource Center. And obviously, the Resource Center links to a lot of this information. So as new communication strategies and ideas and just grassroots techniques to get information out to the community, that information will be made available to you also. So again, glad to be a part of this today. And I said, let's just start out with what is. For those who have not seen this, there is a customizable communication toolkit that's available on the Resource Center website. The address is up there. I think we can have this probably the address sent through to you also. So for those people who have not accessed it, but when you go into the website, you can find this in the main navigation within that. What it is, it's customizable templates. Many of you are wearing different hats, or you don't have the budget to actually put together communication pieces. This is a quick resource, and it's not just focused on COVID. This is focused on a number of different items, or if you want to say individual campaigns. COVID vaccine confidence campaign was actually added, I want to say June of 21, we added that in. So we are hearing that some of you have used that. This piece is a little bit, it's not coming from your organizations. It's actually just more of, if you want to say, white labeled communication pieces to provide education, to address myths, and really have individuals really learn more about the vaccines, about COVID, understand this, but still, bottom line, make their own decision on what they want to do. So that, as I said, was added to the general confidence campaign, a swing bag campaign, a preventative screening campaign, and a telehealth campaign. So I'm going to go into each of those just real brief for those people who have not seen it. So the templates are made up of, when you look on screen, not every campaign has all of these elements, but this is just kind of a broad list of what could be part of this. All of them do have print as part of that, being print advertising. But when it comes to the other pieces like radio scripts, educational brochures, direct mail pieces, social or digital content, in-house posters that are complementary to the print pieces, screensavers, or produced radio and video, website landing pages, and then internal educational tools. As I said, these are things that will give you a jump start into doing this. So let me go into the first one, COVID-19. These are the templates that are included within this. So I'm hoping that some of you have had the chance to use this or preview this. But when I said before, it's based on learn, understand, and decide, and really addressing, within these print ads, it's more from a high level of providing that understanding, that knowledge that it's still your decision, but that decision can help end this pandemic. So not trying to be heavy-handed, but that is the direction we're going. And I think we heard that even when we spoke to many of you, a few months back, is that being able to take that, if you want to say, that conversation out into the community, you sometimes need some tools to be able to have that to share with, whether it's this type of piece or a brochure to take with, to be able to have that information to share. It's just, talking tools to, again, hopefully have that discussion or stories, to share those stories, to say, this is what I'm going through. And, we're hoping that you can learn from this and make a decision on your own on that. So that, as I said, you're going to see some things where we expanded from the previous one, from that I'll share later. Confidence in general. When we launched the original toolkit in February of 21, confidence, what it really means is really, how do we re-engage with our patient base and our community again, and how can they believe in us and what we do? So we want to recognize, or we want them to recognize, the quality care that's still happening locally, and recognizes the people and the individual and the services that are right here. So with that, we developed newspaper, radio scripts, a recorded radio spot also that could be donated with your name at the end, that you could provide to a radio station, a recorded video that could be used for digital, that it could be used in social media or even streaming video. In-house posters, the computer screensaver, the website copy, social media, and then the digital banner. This is probably one of the more robust campaigns, but we did have a number of organizations that reached out to us for customization of this. So we did know that it was being used. The tip that's off to the side is really touching on the photography. The way that these are built, you can actually, and I'll touch on the how-to, but you can update the images with your people. We provide tips within the guide of exactly how to shoot these images, but everything that's on screen that's here, where you see amenity health, you see the call to action, you see the services, you see your hospital name appearing in the copy. These are things that you can go in and actually update after you download the file. So that's what we mean by customizable. Okay. Prevention, again, quite a list of opportunities, much like the previous one, but this is broken down into 3 campaigns based on colonoscopy screening, mammography screening, and the Medicare wellness visits. So really trying to encourage people to take care of their health, get those screenings. The concept behind this is really based on facts about these, the first two national statistics, but really, again, encouraging them to make that appointment for screenings. The wellness visit is something new for some people that they're not quite sure what that is. And so we do provide information that it goes beyond a print ad. This is the one that has more of the direct mail. It has some educational support, so people understand what that opportunity is. And I think it's a great opportunity for your organizations to re-engage with a patient base that may not be taking advantage of your services and get them back into caring for their health with that. So that is that. Swing bed or transitional care, we kind of, within the campaigns, we refer to them as transitional care because people, I think for patients or communities, they're not quite sure what that is. So we do use the terminology of that. But again, this has a little bit more support of newspaper, educational brochure, program summary that would be used for discharge planners, and then also the in-house poster. So it is based, the concept is based on shortening the distance between healing and home. Offers the chance that obviously not all programs are the same. So we want to make sure that from a bullet point standpoint, you highlight the way that your program is built on that. So, and then telehealth, again, each telehealth program is a little bit unique based on the software you're using, but the mediums that we distribute this information out, we think it works with all of these, as the being able to reach your communities, make them aware that there were alternatives in care. When this launched, this was something that, at least my understanding, Delta organizations, many of you were actually setting up programs like this. So the timing may not have been, we may have been a little bit early with the launch of this, but there may be organizations that can take advantage of this now. Again, it doesn't get into as much the how to use it, because as I said, the platforms are different, but it does offer the chance that you can touch on what are the services you're offering and where they go to get more information about that. We do include, and I do want to point out one piece that is very important, video etiquette tip sheet. It's a piece that we have found with our clients that are utilizing this, that it's not as just as simple as, here you go, use the program, whatever provider it is. It's making sure that they understand, they and their teams understand the right way to use it, the right way to project yourself on video, and the surroundings and the sound and everything, so that the patient experience is just, maybe it's not the same as being face-to-face, but you want to make sure that it still has that feeling of understanding and that face that they know. The campaign does offer, again, the chance that the faces that are on the tablets can be customized with your providers, so you can actually drop in their faces into that. So, which is kind of cool with that, with faces you know. So how do you get to this stuff? When you are on the site and you click into the toolkit and you go to that master sheet of what is included, if you click into, say, for instance, the confidence campaign, you will see a menu like this. Every single one of these items, once you click into it, is an automatic download to your computer. It is either going to be a PDF or a Word document that's going to be there, or for the broadcast pieces, these are MP3 pieces or video files of sorts that can be shared at that point. If you were wanting to customize, many of you have seen this already, but if you want to customize, and this is in the toolkit guide, you basically go into the PDF and go into, you need Acrobat Pro to do this, but it allows you to select Edit PDF, and basically everything becomes active at that point. That you can update copy, you can update your logo, you can update the photograph also, if you feel like you want to do that. But it's a pretty easy thing to do it if you have that program. And I understand not everyone has it, so when you look at it, Acrobat Pro is, as I said, kind of key to the core communication pieces that have graphics to them. Microsoft Word is going to be used for, it could be the social media posts that you can cut and paste, the radio scripts, pieces like that, so you can access it through that. The last piece I note is that all of these files are available through what we call Creative Suite or InDesign. That's what we design them on. We're not sure, you may have relationships with, it could be printers, it could be, maybe it is a designer, but there is a good chance that they may work in this platform. If that is the case, you would then make the request to the resource center that could you have Legato transfer these files to whatever printer, whoever it might be. And we can do that. We can package these files and send them to them so that, again, it may make it easier for you for customization, okay? So any questions on, for people that have not seen this, any questions on the original toolkit that I can answer at this point? And I may have, if you see something come in, Ambrisha, let me know. Nothing?
Nothing.
Okay, all right. Well, let's go into phase 2. We're going to go into what is. So what I'm sharing with you, some of you may have seen this. I participated in a webinar through NRHA about 3 weeks ago. Those who are familiar with Brock through NRHA, he had shared some information as part of that presentation, and I found it really extremely interesting. And I think there are 3 slides here I wanted to share on what is. So when you look at this, what we're looking at is we want to look at the non-metro areas, and this is back in January. This is coming off of holiday seasons, but with that, which is kind of scary, which is anything that is marked in the black and the red. Those are non-metro areas, and at that point, we were talking about very high levels that were occurring within that. It's obviously the good thing is, if I bring that exact same picture that's occurring here, that the infection rates now have dropped. So when we look at that, of the red and the black is still there. When you look at, Minnesota still has quite a bit within this, and there are other states that are showing that. But at least when we go to other areas, we're seeing within this, especially like within the deeper green is considered non-metro, and it's dropping lower than 100 cases per 100,000. So that's great. So you kind of look at it and you go, well, why are we even worried about this anymore? Why is this initiative still important? Why should we be doing communications? Because we're seeing this drop. COVID is over, but it's not. And I think it's the thing that we are seeing is that infection rate right now is we're running as far as at least the information that was shared during this through NRHA is they're indicating the infection rate as of 3 weeks ago is still 2 times greater in rural areas than it is in other areas within, as far as the metro areas, if you want to say per se. When you look at the related death rates within that, they count, even though the rural areas are about 14% of the US population, the death rate is about 23% of the nation's COVID-related deaths are related to those smaller metro area, or the smaller areas within this, in the rural areas. So it is concerning, even though you do feel like numbers in regards to vaccination rates, you're seeing higher levels within rural are starting to be here in regards to the darker green, but there's still a vast area that within rural that is still that light green. So there is still work to do, and that's why this is still important that we so focus on this. And I think it is. There's been a lot of question, even in regards to just general vaccination, the momentum that we need to carry forth, that it's not just COVID vaccinations or whatever the future of boosters are, but we want to be able to push this even further. So good news, vaccination rates, if you want to look at rural populations as a whole, it's close to 50%, and that's fully vaccinated. You know, what compared to Metro is about edging towards 65%. So, you know, there is still momentum going there, and we're still gaining, but we still have work to do on this. Okay. So as I said, I found that interesting. For those who hadn't seen it, I thought I would include that. So what we did here, and I heard this, you know, I mentioned it earlier, was that we still need to be able to provide tools to you to be able to take this information and bring it out into your communities, whether, yes, it can be done internally within your healthcare facility, but community-based groups, faith-based groups, local businesses, and I'm not talking manufacturers, it's the local, you know, places where people are at, where they congregate business-wise. I think we heard, you know, that it was like, well, the hairdresser. It could be, you know, that you have that information and you want to be able to talk about it with that. The public health organizations are a great partner, but they too are needing support with additional information. And then the schools, with the ages dropping to the 5+, we heard it loud and clear that we do not have as much information about that we can share. So what's new? With that, we knew we had to update the content that was originally launched in February, or take that back, in June, that was launched in June. So much has changed in that period of time, that short distance of time, that the brochure that we had that really laid out more of the facts was out of date. You know, everything from the ages to the boosters to even, it could be a question that we hadn't heard before. So we have updated that. We've expanded the print ads and posters. The quantity, we have a much greater amount, and I know that further down it says greater diversity. That was part of what we had done within the print ads and the posters, is to make sure that we're representing rural America in a much greater, you know, a larger amount that you can select from. So you can go through it and kind of go, if you do decide to use the imagery that's in these pieces, you have a better selection to pick from. The big thing, Spanish translations. That was a piece that we offered a little bit, but now every single item that we're offering you is translated into Spanish. So, except for the social posts, those were not. So that is within the COVID-19 campaign. All translations are there. And then we've updated the social media content also. So when we look at that, one thing you're going to notice, we still have the original 6 are part of this, where there is masking occurring. But you're seeing a little bit more, a little light at the end of the tunnel, that there's less masking, greater diversity in age, color, male, female, complete families, how that is affected with that. We've updated the content slightly as far as the body copy, but as I said, we retained that learn, understand, decide. And again, every single ad is available in Spanish. And these are, as I said, representation of the posters also. Educational brochures. We do the original one to the right, which was the one that basically provided information, that provided the facts, throughout the whole thing. That again has been updated. But the one to the left is brand new, and this is focusing on children. So this is a great piece for parents. It's a great piece for anywhere that there is an audience where parents, or it could be the school systems, it could be the churches, it could be, you know, as far as where there are children, and you want to get that information out about this. It does include some facts, but it is really looking at kind of who can be vaccinated, who can be boosted, why it's important within this. You know, it's got a lot of the whys. So we're hoping this is a nice piece to be able to support the conversations that you have internally and externally within your communities. Again, both pieces have now been translated into Spanish with that. The Idea Starter is a brand new piece that it is, again, we look at this as really a like for the 5+ audience, what can we do to engage that audience? Not the 5-year-olds, but the parents, or it could be, you know, really anyone that wants to learn more about this. And when we say this, yes, it's as simple as, you know, you see the brochure. Yes, you can do things socially. On the backside, there are more things that are more event oriented, just ideas that you could do within your community that 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 can engage the families and educate them at the same time. And hopefully, you know, in certain instances, you may have the opportunity that you could actually offer vaccinations at the actual event too. But it's also how do you align it within other community activities that are occurring. So I encourage you to take a look at this piece, and also share it amongst yourselves. If there are ideas, we'd love to hear more ideas and be able to keep expanding this as more tips and ideas that worked in your community that we can just kind of build upon this piece as a, you know, but as I think as an idea starter, it may be some of the things you're already doing, and good for you that you're doing it. And we're hoping that some of those are working, but maybe there are some new ideas in here that you haven't looked at yet. So, you know, that is a piece that it's more of a tool for you, but it could be shared with others. And then, as mentioned, social media content is provided to you as a Word document. Everything has been updated within this. So we have a series of posts that gives you that, again, that if you want to put it as a jump start to be able to write social media content, to incorporate into your existing calendar of social media along the way. But hopefully this will be some inspiration to be able to add to that content. So that is what is included in phase 2. Customization is, I wanted to expand upon this a little bit more within what it does mean. We've had, in phase 1, we did have organizations, Delta organizations, reach out through a request process. And if you are looking for, you look at this and you go, that's great, but I can't do any of that. Even though you're giving me all this stuff, I still am challenged with having to produce these things. Or maybe the message isn't quite right for what we're doing and we need some assistance with this. Or there's also, I need this item and it's missing. And it's like, great to have the kit, but I'm missing this. That's where the requests come in. And the requests go through the Delta program's request for ITA services form. This form, which you use for other things, you are placing that request in. So you should be familiar with where the link is on that, but Brisha can get you that link again. And with that, what it means for the toolkits, and this is kits, this is everything. This offers the opportunity that Legato, if approved through the Resource Center, if they say, yep, let's go ahead, just think about it that the design support is there, the photography placement, you know, you're like, we can take the pictures, but we can't get those into that. We can place that photography for you. We can do the updates to the logos or assist with copywriting or content changes. And one other piece at the bottom, translation services. Toolkit, translation services, we have been offering this support through the Resource Center for other things too, but or other projects. But within this campaign, if you are seeing the need, yes, we offered everything in Spanish, but as you start to make modifications to pieces, you may need support to actually have it translated again. So that support is there, but think beyond Spanish. Your community may have a very, you may have a French, you may need French. You may need, recently we've been working in Mayan. You may have some other languages that you're gonna go, this would be great, but Spanish isn't doing it for us. Our population is, we have a very large population of this. And let us know that. Or it could be the opposite of even just the imagery. We have a large population of Native American, and I'm not seeing a lot of options there. So these are the types of things that if you are seeing the need, I encourage you to reach out to the center to Ambrisha, to others, and say, we need help, and start that discussion. And then at that point, they can invite us in to see how we can help you with that. Okay. So in conclusion, and I know this was kind of a pretty brief webinar, but that's okay, you get time back. So in conclusion with this, that's the address again, how to download, and we'll get that to you. The first piece you should go into is look at, there is a user guide available within the downloads. So go to the user guide and it'll give you kind of a recap, but it's going to show you everything that's available within that. So I think it's a real nice snapshot rather than having to click into everything. Bottom line, our goal, the Resource Center's goal, is we're trying to save you time, effort, money as a whole, so that you can get communication pieces out into your communities. The customization is available, so you see the need, please reach out for that. And then bottom line, start sharing these pieces within your hospital, within large, small businesses within your community, and then wherever people are at in your community, even to your families. Share this stuff so that it can be passed on, so that they become advocates for this. And I think that is our strongest voice versus, I hate to say, a print ad. So that is what I have today.
Okay, well, here's our contact information. If you think of any questions following this webinar, please reach out to myself or Brian, and we'll be happy to answer any questions you might have.
Yes.
And we want to thank you all for attending today. And now you have a few more minutes back into your day. Thanks,
There you go.
everyone.
All right. Thank you.
Thanks, everyone. Have a nice day.